I just happened to like bump into a friend who went to this gynae who also specializes in fertility. So I decided to go to him, and that was sometime in 2017 as well. We went to see him, and then we did like a series of tests. So I think at that point we were already very disappointed. Like it's been such a, it's not very long, but it's also not a very short period of time. Yeah, and like as for a woman to keep seeing red every month, you know, it's very frustrating for a couple who's been trying for so long. I think right from the start we were very open with each other. Like we had a conversation where we were very honest. Like, you know, if you don't do this, it's okay. Just tell me. We had that conversation, and I think that kind of set like the foundation of us doing and trying together. So we knew it's going to be a challenge to get to having a kid, and I think that was where each other's support came into like, you know, to remind each other, I guess. So I think that was very important, and like I feel that I was never alone. Even when I went in alone to do like my consultations, I had never felt alone. Like if he was at work, he would text me, "Are you okay? Like what do you need?" Like
good on you, Bernard.
Yeah, he's very supportive. I think having a very supportive husband.
Did he help you with the self-administered injection?
Yeah, he did.
Wow.
Yeah, he did.
I don't know if I can.
I mean, he had I couldn't do it myself, so I told him.
Did you try doing it once yourself?
The pen one is easy. The vial one was difficult. So I said, you just do it. I can't do it.
Just like a
yeah.
Well done. Dr. Balaji, while they pull up the slides, let's talk about this. To me, before I saw the slides, before I came in today, I thought IVF was like a 90% thing. What are the expectations of some of the couples that go to you?
Right. Now, whether it's natural conception or it is IVF conception, age of the woman plays a major role, right? So, because of this, egg quality and quantity actually depleting every year, the chances of conception also is affected by the age. And of course, another factor is how severe the infertility is, right? So in this slide may show you that below 30 is very easy to conceive. So we see that per egg collection, there's a chance of 70%, right? But when you go higher and higher, like 35 to 39, from 72% it drops to 53%.
So a lot of people are familiar with the concept of either IUI or IVF, but they don't realize that actually we can do a lot more as well to help with improving your natural chances of conception as well. So my advice for couples would really be, after a certain time frame where you have been trying on your own, it might be better to seek some medical opinion or some fertility health assessment first, because you might find certain conditions that might be amenable to surgical treatment, for instance, that might help improve your chances of trying. So surgery may be able to treat certain conditions like endometriosis, fibroids, polyps, ovarian cysts. Okay, essentially certain lesions inside the womb, for instance, scar tissue or a septum that may block, obviously, implantation. And sometimes tuber blockage can also be relieved with surgery. So all these things can be treated with surgery, and that helps to either restore your natural fertility to that which it should be at the age, or improve your natural chances of conception. Sometimes these surgeries can actually be performed before IVF to improve the chances of IVF itself. So for instance, there are some ladies with blocked tubes with a collection of fluid in the tubes. So essentially when you have blocked tubes, you have no choice but to usually undergo IVF in order to circumvent the tubes. You have to get the eggs extracted and fertilized in the lab instead. So for these patients, the fluid in the tube is actually toxic to the it forms a toxic environment for pregnancy. So generally the chances of success of IVF would be lower. So surgery is done to relieve this blockage, remove the fluid, either that or also sometimes to clip and remove the connection between the tube to the womb so that the toxins don't get into the womb, and therefore help with improving the chances of success of IVF. Ovulation induction is very suitable for women with irregular periods, or even some women with regular periods who actually may not be ovulating. And ovulation induction is given, as Jane mentioned, sometimes with oral medications like Clomid, and sometimes injections are also used. And this is used along with time intercourse. And I think the time intercourse, time love making is the usually the most tedious part of the whole process. Where it's very stressful. Yeah, and that's what I meant also by intense trying. Okay, essentially you put a calendar on the wall and you mark. Basically, in SOIUI, there are two key aspects. One is timed ovulation. That means we give you an injection to trigger ovulation, so we know the exact timing of ovulation. Whereas in trying to rely on your natural ovulation, there's a bit of a guesswork. Yeah, and after ovulation, the reason why this timing is so important is because after ovulation, there's about a 36-hour window for fertilization, which is very short. It's only 1.5 days. So getting this timing right is important. And the second aspect of IUI is getting more sperm nearer the egg. So what happens is that the sperm is collected from the husband, and then the lab nicely concentrates it to the fastest moving sperm, and so instead of a few million in the vagina, a few million sperm in the vagina in natural intercourse, you're putting a few million of good moving sperm in the womb, where it's much nearer the egg.
Right.
Yeah.
Cheat a bit.
Yeah, it's a cheat. Okay, so essentially that helps, and so when it's used in combination with ovulation induction, you will find that the success rates increases with stimulating the ovaries as well, because in natural ovulation only one egg is produced. Depending on your age, that egg quality may not be so good. Yeah. So when we use stimulation medicines, the hormonal injections, we can get more eggs, which means more chances. So essentially, the whole process of SOIUI is just to try and increase your chances of conception within the body as best as we can. So it's very suitable for ladies who have problems with ovulation, and also couples who have unexplained difficulty in conceiving, but for a shorter term duration.
So in TCM treatments, we actually make use of the acupuncture, moxibustion, herbal medicine, and also sometimes cupping for fertility treatment. So what happens when you go to a TCM physician is that we'll look at some of your fertility screening results, and then we'll use what we call the 4 diagnostic methods of TCM. So John actually stuck his tongue out at us, at me, and also
She asked me I
was like, can you show me your tongue? And then he stick out. And then we also feel the pulse, and we ask a whole list of questions. So I think one of the things that made an impression on you was like, how's your poop like? How's the consistency? These are some of the signs and symptoms that help us understand your fertility health better from a TCM perspective.
Right. But for us, we were not sure whether there was something we wanted to do just yet. We understood that acupuncture involves the neck as well, right?
No, so acupuncture, we insert needles into specific points in your body. So in TCM, we have what we call meridians and channels.
Right.
And these are like the MRT system of our body. So for example, if the MRT breaks down, like recent power outage. So there's a lot of chaos happening in the stations, right? So when we, similarly to our body, when the energy and circulation is not so good, we have a lot of issues happening. So when we stimulate these specific points in the body, it clears up the mess.
Right.
Yeah, so it activates the self-healing properties of our body. Yeah.
Right. And this process, is it usually like a treatment of sorts? You go and then you're done, or you have to go back every week for a long time?
Yeah, you have to come regularly. So for TCM, unlike IVF, it's like a 6-week thing. But TCM is an ongoing thing, and it is actually the accumulative effect of the treatment that really matters. So it's not like you come in and then like I feel your pulse and tell you like this and that. TCM is also a lifestyle. So on top of the treatment that we give you, we also provide some of the lifestyle and dietary tips that you should be taking note of.
Right.
Yeah. So I shared with you, right?
Yeah. Stuff, very hard one. No, I'm kidding. So for the couples out there watching, how would you advise them on when do we go to a TCM fertility center or clinic, or when do we go to a Western one?
Okay, so for couples who come to us, there's basically different types. So there are those who are just married and then they just want to get their fertility health enhanced. So they haven't been to a doctor for any fertility screening, and they just come and regulate the body. So for these patients, as long as they're young enough, we will proceed with maybe 6 cycles, and if nothing happens, and then we'll refer them to like Dr. Tong, for further health checks, so that we don't hold up any possible underlying issues.
Right.
Then there's another group who are in between IUI, IVF treatment. So for example, like they just did their first cycle and it failed. So some of them actually found out from internet or something that, hey, I can go for TCM. So they come over and then they try to give themselves some time to regulate the body, enhance it, and then go for the next round. Then there's the other group who are actually doing the IVF and IUI treatments. And these are the ones that we typically do acupuncture only. Because we do understand that there's the concern about herb-drug interaction in the patient's body. So when they're doing the stimulation and so on, the acupuncture is done to decrease the side effects. So basically, reduce the bloating, the anxiety, and also the stress that the patients are facing. So clinically, when we see these patients, quite a number of them actually reflect the stress that they go through when they do the injections and so on. Yeah. So these are some of the issues that we deal with, and of course the underlying TCM syndrome or the body constitution that we can help to improve.
Right.
Yeah.
First of all, get pregnant earlier. Sooner, at a younger age. Then nothing beats that, in terms of egg quality. Beyond that, there are certain supplements that we can give to try and improve egg quality. And on top of that, try to maintain a healthy lifestyle, avoid smoking, drinking, excessive drinking of alcohol, excessive caffeine intake. And all these things will help as well.
For guys, how do we then improve sperm quality?
So the general advice would be to keep the testes cool. So I'm sure your doctor will have advised you avoid tight-fitting underwear, hot spas, showers. See if your line of work you have any long contact. For chefs, they are always in prolonged contact with stove and heat.
Right.
And then drivers, they spend very long time on motorcycles and vehicles. These are usually associated with a slightly poorer sperm quality, because of the vibration injury as well.
So in our practice, right, the worst thing that we experience is seeing patients who actually self-medicate for a while, and then they got their health into a worse state without knowing. And then they come to us, then we have a much more worse mess to deal with. So really go find a licensed TCM physician to really find out more about your fertility health in a TCM perspective before you medicate yourself.
But when it comes to sperm quality, just I would like to say something.
Yeah.
You mentioned about lower normal morphology. Normal morphology is just one of the parameters. So semen analysis has so many other parameters. So we have to look at the volume of the semen sample and how many are moving and what's the total count of the sperm. So even if the morphology is lower, if the count is higher, that's going to compensate for this. So the sample has to be looked at holistically, not just one parameter.
Okay. We have a couple that ask, for couples below 35, can we go for fertility health check after 6 months of trying? Can. Any help you there? Haven't tried also can. In fact, I think what this whole session is about is trying to get you to understand, trying to get you to make an effort to understand your own fertility health better. In fact, you can even do that before you get married, before you settle down. But of course, if you are looking to do it as a couple, then of course, when you get married, then as soon as possible or as soon as your relationship gets serious. I think for my relationship, it really helped us beyond understanding the health conditions. It helped us understand beyond our bodies. You know, many of the things that we discuss here today, if it's new to you, it would not be new to you had you gone for a fertility checkup. I think a lot of these questions were answered by the doctor at the fertility center as well.